On the 1st February 2021, there was a military coup in Myanmar. Myanmar was being ruled against under the military after 10 years with democracy reforms. The military controlled everything after a general election in which Aung San Suu Kyi's National League for Democracy (NLD) party won by a landslide. They were being arrested because of false accusations. After the coup, there were massive protests in the whole country. Thousands of people, including the health workers, joined to be activists. People who opposed the military established a parallel government known as National Unity Government (NUG). A few weeks after the coup, the military was brutally attacking the activists, including the health workers. More than 8,000 people were arrested in late 2021, and around 1.5 thousand people have been killed by the military forces. The hospitals also have been occupied, shot at, and destroyed by the military. This awful situation happened during COVID-19 pandemic. It made Myanmar got the fourth highest mortality rate in Southeast Asia. This war caused a lack of medical workers. Most medical workers who have left their jobs become volunteers. They built a shadow health system under the NUG, and it is working in charity clinics or those private hospitals and using encrypted communication apps to avoid detection. They also use telemedicine to treat patients during COVID-19. In fact, when Aung still led Myanmar, they received 1.5 million doses of COVID-19 vaccines from India in January 2021. But after the coup, the vaccine program didn't go as planned. Many health workers announced a strike and they were refusing to work for the military regime, so Myanmar had a medical workers crisis. Because of the crisis, the government has taken some actions such as vaccine distributions, additional medical professionals, thus the supplies of essential medicines have improved. Myanmar also has to take more action to handle the interfered healthcare section because the supply chain in the healthcare sector got affected. Myanmar got help from other organizations such as Medicine Sans Frontières (MSF). The MSF has directly sent Myanmar vaccination supplies to overcome the lack of vaccine for Myanmar's population. This action fixed a few parts of the vaccination chain supply. Despite MSF's help, there were Gavi, UNICEF, and WHO who also gave COVID vaccine. Because of that help, the supply chain of vaccine program is going well. Myanmar has fully vaccinated more than 27.5 million people, according to its Ministry of Health. The ministry said the country had administered over 64.1 million doses of COVID-19 vaccines and more than 2.4 million people have received booster shots. The daily positivity rate was decreasing to until 0.12 percentage.
Military coup is indeed very heinous. The military was brutally attacking people who are the opposite of the military. They don't look at age, gender, and occupation. Anyone who opposes the military will be attacked. Around 1,500 people have been killed in the military forces, and more than 8,000 people, including medical workers, were arrested in late 2021. It causes the military got condemnation by United Nations, foreign governments, and right organizations.
United Nations Human Rights Chief Michelle Bachelet called the executions that happened in Myanmar a cruel and regressive step. UN Secretary General Antonio Guterres also strongly condemned the executions and called again for the release of all arbitrarily detained prisoners, including Suu Kyi. In a joint statement, the European Union, Australia, Canada, Japan, New Zealand, Norway, South Korea, Britain, and the United States described the executions as reprehensible acts of violence that further exemplify the regime's disregard for human rights and the rule of law. This military coup happened on COVID-19 pandemic. Certainly, Myanmar needed a lot of medical workers, but unfortunately, 70% of health workers have abandoned their jobs. It happened because many medical workers were arrested and killed by the military forces. Hospitals have been occupied, shot at, and destroyed. Aid and medical supplies also have been blocked by soldiers. Therefore, Myanmar had medical issues. The civilian was struggling to get health treatment. Thousands of people died and mostly at home without having any access to health support. In the end of 2021, the death rate of Myanmar due to COVID-19 was increasing. Myanmar's Ministry of Health counted nearly 20,000 recorded deaths from COVID-19, and it made Myanmar got the fourth highest mortality rate in Southeast Asia. Because of this situation, they need to roll out vaccine programs to prevent the daily cases of COVID-19. Before the first vaccine program started on 27 February 2021, the total cases of COVID-19 were 138,802 and the total deaths were 3,089.
To prevent more cases and deaths of COVID-19, Myanmar received the first batch of COVID-19 vaccines from India. They received 1.5 million doses of COVID-19 to inoculate 750,000 people. After the vaccine programs, the number of daily new cases was decreasing, but it couldn't go static. They still got new cases daily, so Chinese Foreign Minister Wang Yi promised Myanmar to give them 300,000 doses of vaccines. After containing the number of COVID-19 cases at the beginning of the pandemic, Myanmar was also struggling with the second wave, recording more than 136 cases and 3,000 deaths. So the second batch of vaccine was needed. Myanmar has purchased 30 million doses of the AstraZeneca vaccine with the state budget from India. The second batch is in addition to the 1.5 million doses of the vaccine gifted by the Indian government on January 22. Myanmar also got another 27 million doses from Gavi, but the COVID-19 pandemic had not done yet. Myanmar needed to face the third wave of COVID-19. The People's Republic of China also arranged to donate 3 million doses of Sinovac COVID-19 vaccines. 1 million doses of them had arrived. As part of preventing the COVID-19 infections, 15.3 million of the people in target groups have been injected till November 20, 10.4 million of whom have been vaccinated 2 times, and 4.9 million injected for the first time. Hence, the vaccination have been undertaken for 25.8 million times till 20 November 2021. Many organizations help Myanmar to get through the COVID-19 such as MSF, Gavi, UNICEF, and WHO. MSF works with Myanmar Ministry of Health to provide care for HIV and tuberculosis patients, primary health care, and vaccination. In 2021, there were 105,400 outpatient consultations, 8,720 people of first-line ARV treatment under direct MSF care, and 29 people started treatment for MDR-TB that MSF had already done to help Myanmar. Without many help from other countries and organizations, Myanmar couldn't get through the COVID-19 under the military coup situation.